Hey, this is Brandon with ChiroUp. Today's blog covers two important topics. The first important topic is understanding the diagnosis. And we all think we understand the diagnosis as far as having a diagnosis. In the case of the blog, we talk about cervical radiculopathy. That's a collection of symptoms that we're grouping together into a diagnosis. The most important part of that process is really understanding the tissue dysfunction leading to that diagnosis. Meaning, was it acute? Was it chronic? Because treatment strategies are going to be much different based on that information. The second piece of that is it a muscle? Is it a ligament? Is it a tendon? Is it a disc? Really understanding the actual tissue that is dysfunctional or causing pain, because that's going to help with our prognosis and the treatments we're going to select to fix that problem. The third being, why is it happening? And that's what we cover on the blog, is that we might get a cervical radiculopathy. It could be due to a disc problem or a degenerative problem or too much activity, but really understanding what's happening for this process. So in the case of this blog, we go over cervical radiculopathy, and as a result of an issue with the intervertebral foramen getting closed down too much, or any motion that causes closing that intervertebral foramen causes pain. Could it be due to a disc problem or degenerative problem? Absolutely. I'm not going to dive too much into that as far as the blog and as far as this video. However, once we know that and that movement reproduces the patient's symptoms, that's when we can dive into which methods are most suitable for treatment. If we just select methods as far as manipulation, mobilization, traction, instrument system manipulation, acupuncture, nutrition, but if we randomly select methods to treat patients and do that for every single patient, our efficiency and effectiveness as far as a clinician are going to drop dramatically. But when we truly understand a condition and only select the methods that are designed around improving that dysfunction, that's when we can have a great impact on care. So that's what we go over in the blog. It wasn't so much that cervical distraction test, which you can see here, alleviates symptoms. It's that when you do the cervical distraction test, it opens up the intervertebral foramen. It's not that when you do Sperling's test and maximal foramen compression test, like you see here, that you're rotating the head and that's causing pain. But what happens is the intervertebral foramen gets smaller. So when you do tests like that and you can reproduce a patient's chief complaint, then you know that's the movement dysfunction causing their pain. Now, in somebody that does not have a movement that causes alleviation of symptoms or reproduction of symptoms, that's when you need to investigate further, possibly imaging, possibly other kind of testing. However, when you can do these kind of tests in a repeatable fashion and they reproduce a patient's chief complaint, that's what we call a clinical prediction rule, which makes us much more efficient in practice. So using those tests will help make that differentiation as far as where the problem is. Now, when it comes to treatment, let's take a look at this video. This video is going to cover different techniques and maneuvers that we can utilize in practice to help open up the intervertebral foramen. I love manipulation. I love, as far as a high velocity, low amplitude thrust to get joints moving, to improve joint mechanics. Sometimes patients can't do those, or can't go through that kind of a procedure, where mobilization might help a little bit more, contract, relax, stretching. Taking a look at these types of maneuvers can really help differentiate you from the other practitioners in your area, being able to identify which methods are most suitable for which patient population. So in covering any way to open the intervertebral foramen, there are two strategies that I like to do besides manipulation. Manipulation is my always go-to treatment. However, some people don't tolerate that well, or they're too acute. So one thing you can do is a movement with mobilization. So what you can do, let's just say this patient's having difficulty with going to the right, she's having pain that's axial in the spine, and you have her do both movements, and you can go through your motion palpation and find joints that aren't moving well. Remember that as the neck turns to the right, you're going to see the spinous processes go the opposite way. You'll have that couple motion all the way through T4. So when you have this patient rotate her head to the right, you want to feel that motion. Let's imagine we don't have that motion and you think there's a hypomobility of that segment. Movement with mobilization is going to find a way to create a little bit of pressure, medial and up. And as she does her movement looking towards the right, you can actually follow that movement and help guide that motion. And then back neutral, and again to the right, and neutral, and right. So you can do 3 sets of 10 repetitions. You can even add a little bit of overpressure in there. Sometimes you see people guide their patient with their hands. I find that when I do that, I lose a lot of my stability here. When you're holding the patient here, she feels a little bit more secure. Now that's a good technique. However, one thing that I learned a long time ago, which I think creates a little bit of stability around the patient and I can get a little more overpressure, is I'll put my foot up on the actual table so she has a nice secure base to push from, and I'm gonna have her actively rotate her head to the right. And as she does that, I'm gonna follow her, that spinous process with my thumb, and then give her a little overpressure. So what I'll do is I'll have her rotate to the right. I'm creating a little overpressure with my opposite hand, and can give her a little bit of overpressure medial, and then back to neutral. And again, and neutral, and again, and neutral. So what she'd probably tell you is I'm going all the way to end range, just following that motion, and then as soon as she hits end range, I'm creating a little bit of overpressure direct to that segment. These are just two ways that I help try to open that space up and get those joints moving if you find segments aren't moving well. Thanks. At home wise, we could take a look at different things like pillow selection, posture, growing taller and helping to perform things like those cervical retraction exercises, which will open up the intervertebral foramen, also promote better posture. So taking in consideration all the things that need to happen to make sure that that dysfunction does not persist is your duty. It's not just manipulation of everybody. It's not just nutrition for everybody. It's not just interferential for everybody. It's selecting the right method for the right dysfunction. When you can do that efficiently, effectively in practice, you'll have a line of people calling to get into your practice. Thanks.